Greetings to everyone who came tonight. I just want to welcome you. This is a special event. This is very unusual for me. This is the first kind of event that I've done like this for this particular event that we hold every year at 10th is the form of a healthcare luncheon in person, live at 10th, and now we're doing this remotely, but it's a changed world as we know it. But just welcome and thank you so much for joining us here tonight. I think you'll really enjoy our program. It is a real pleasure for me to prepare this because it is really a celebration. And we want to start with Dr. Laura Layer, who's the Director of Medical Campus Outreach, and she'll be giving a few announcements. And we'll follow with Dr. Jerry Jacob, who will be giving a COVID overview, an update for people who are interested in knowing any previous information, but as well as some new information that we might know about the virus at this point. And then we'll follow with some really great news about SMI 2020 and how the program went and hear from some of the students themselves. So with no further ado, we're going to get started. And Laura, I'm going to turn it over to you. And if you have any announcements, we'd love to hear them.
Yeah, first of all, I'd like to say a short prayer, and then I'll go into some announcements. So let's pray. Dear Heavenly Father, we thank you so much for this lovely opportunity to get together and celebrate the fact that the pandemic did not divert SMI 2020, and we're so thankful and grateful that was able to happen to your glory and because of your grace. And we thank you for our ability tonight to come together and celebrate that fact. In Jesus' name, amen. Also wanted to let everybody know that our next event coming up is already on the schedule on November 8th in the early afternoon at about 2 p.m. in conjunction with 10th Presbyterian's Global Outreach Week. We will be having two. I'm sorry?
Can you come here a minute, please?
Oh. Sorry about that. We will be having two speakers, both of whom have experience as Christians giving healthcare in Muslim majority contexts. And so we are happy to hear from them. And one of them is connected to Summer Medical Institute, Dr. Guy, who is in Eastern Europe normally and works with a clinic in Eastern Europe, in a Muslim majority country in Eastern Europe that SMI visits every other year. So he will be joining us. And another one is Susan, a nurse who spent 20 years a career in a war-torn country of Central Asia as a nurse with her family. And so we're looking forward to hearing from them. So that will be November 8th at 2 p.m. in the afternoon, and it'll be a virtual event.
Great. Thank you, Laura. Okay, so we'd like to get started by just sharing a little bit about the virus. We know we're in the middle of a pandemic. There's lots of information that spreads around, and by now we hope most of you know the basics about what the virus is and how it's transmitted, etc. But we thought it'd be really helpful to have Dr. Jerry Jacob give us an overview and some updates. He did a wonderful job speaking to our students this summer during SMI, and we thought it would be great to have him share a little bit because it's appropriate. He is a 10th member. He is also infectious disease physician at University of Pennsylvania, and he also is a former SMI alumnus. So we'd like to welcome Dr. Jerry Jacob. Thank you, Jerry, and welcome, and thanks for coming here and speaking to us tonight.
Thanks, Holly. Good evening, everyone. Let me see if I can try to share my screen here. Let's see. So let me try that one more time here. Hold on. All right. Can you see that?
Yes.
Okay, great. Good evening, everyone, and thank you, Holly and Laura and MCO for this opportunity. SMI really did have a lasting impact on my career as a believer in medicine, and so it's really a privilege for me to come back and be able to speak here and to celebrate SMI, the SMI group from this year. So thank you. So I want to dive right in because I want to stick to our schedule, and I'm going to try to share some what I hope are high yield points about the pandemic here. And I thought I would do that by answering 3 questions. So first, what happened over the last 10 months? Why did the world get turned upside down? 2, what should we be doing now to prevent further infections? And 3, what can we expect moving forward over the months and over the year to come? So let's start with the first question. So what happened over the last 10 months? So I think it's important to be clear about our terminology. So the virus that caused the pandemic is called SARS-CoV-2. That stands for Severe Acute Respiratory Syndrome Coronavirus 2. It's called SARS-CoV-2 because there was a SARS-CoV-1 back in 2003. And this is actually just one strain of a family of viruses called coronaviruses. And there are actually 4 strains of human coronaviruses that circulate every year. They cause the common cold and generally don't cause any severe disease. Most of us, if not all of us, have probably had a coronavirus infection at some point because it does come by every winter season. It wasn't until SARS-CoV-1 came on the scene that we started to see pandemics associated or epidemics associated with these types of viruses. And so this is the 3rd novel coronavirus outbreak this century. SARS-CoV-1 came in 2003 and went away quickly. We haven't seen a case since 2004. And in 2012 was MERS, which is Middle Eastern Respiratory Syndrome. And that sort of smoldered along with intermittent cases, but of course nothing of the magnitude of SARS-CoV-2. So the disease that the virus causes is called COVID-19, which stands for Coronavirus Disease 2019. So that's actually the symptoms and the signs that people have related to the virus. And it's believed that this virus actually originated in bats. So I mentioned there are 4 strains of a human coronaviruses. There are actually lots of strains of coronaviruses in birds and mammals, and particularly in bats. And so it's thought that at some point the virus jumped from a bat into another mammal, and then from that mammal into humans. And the initial thoughts, at least, were that this happened in the setting of a live animal market in Wuhan, China, back in the fall or winter of 2019. You can see some pictures from that market there. And this is sort of a prime place where animals can trade viruses back and forth, and the virus could potentially jump from an animal to a human. And so it's not entirely clear whether it started here or whether this was just a super spreader event, but the earliest cases we know about are tied to this market. So then what's happened over the past 10 months? So since December, we have had about 35 million global cases. This is a map showing the distribution of cases across the world. And we've had about over 1 million deaths so far. And you'll see there on the left-hand side the number of cases by country, with the US leading the way at about 7.4 million. And the number of deaths by country on the right-hand side, with the US about 209,000. So we count for about a 1/5 of cases worldwide and a 1/5 of deaths worldwide. And of course, there are a number of caveats you have to mention when you present these sorts of numbers. The actual number of infections is probably much higher than this because there are a lot of people who are either asymptomatic or who have very mild symptoms who never present to care, and so they're not a confirmed case. And so the current estimates are that there are probably 8 to 10 times more infections than what we're seeing here. In addition, there's questions about how well reporting is done in different countries across the world, as well as testing capacity in different countries. So I offer this information with all of those caveats in mind. So looking a little bit closer to home, this is the course of the pandemic in Philadelphia. And I mentioned, one important issue is testing capacity, right? So the top graph that you see there in blue shows the number of tests performed each day from the beginning of the pandemic in about mid-March until now. And then the middle graph shows the number of positive tests. And then the bottom graph is the test positivity rate. So the number of positive tests over the total number of tests, right? Which is a good measure of sort of how fast the virus is moving. And what you'll see is, of course, in the in the spring. And in mid-April, we had our peak where there were a lot of cases. Our testing capacity wasn't great, and so our positivity rate was high. Then it declined, and by about the beginning of June, our positivity rate got down to about the 3 to 5% range, and we've been hovering around about 3% since that time, and our testing capacity has been pretty stable over the past couple months. So that's a good place to be right now. So how do we determine the impact of a disease like COVID-19? So I think when you think about infectious diseases, there are a number of factors that will determine how much of an impact it has on the world. And I think the two most important are, one, how contagious is it? And two, how deadly is it? So this chart graphs those two metrics on the X and Y axis. So on the X axis, you're seeing how contagious the virus is. So the further towards the right you are on the graph, the more contagious the virus is, the faster it spreads. You'll see, for example, measles and chickenpox are very contagious. Thankfully, we have vaccines for those viruses. And then in terms of how deadly a virus is, the higher up you go on the chart, the more deadly it is. You'll see some of the most deadly pathogens that we deal with are Ebola or bird flu or even MERS or SARS. And I put a star where we believe COVID-19 is. So in terms of how infectious it is, the R value, which is what's being graphed on the x-axis there, is about what we think is 2.5, and that means that on average, each infected patient with COVID-19 will infect about 2 to 3 other people, so about 2.5 other people. And in terms of how deadly it is, the mortality rate is estimated at about 0.5%. So that is more contagious and more deadly than the seasonal flu, but certainly not as contagious as chickenpox or measles, and certainly not as deadly as Ebola or bird flu or any of those other viruses up top. And of course, there are a wide range of manifestations of the infection. It ranges from being completely asymptomatic. So the best estimates from the CDC right now are probably about 35 to 40% of people who pick up COVID-19 are completely asymptomatic. And then, of course, there's the other end of the spectrum where you can develop a severe pneumonia that is potentially fatal. Among those who are symptomatic, 80% will have mild disease. And by mild disease, I mean that they will have symptoms that can be managed at home. They don't have to be seen in a hospital or even in a clinic. 15% will require hospitalization, and 5% will require an ICU admission. The most common symptoms you'll see are fever, cough, and shortness of breath. To a lesser extent, you might see muscle aches, headache. Something that's somewhat unique to COVID-19 is the loss of taste and smell. And if you see that in particular with GI symptoms like nausea, vomiting, and diarrhea, that can be a little bit more specific for COVID-19. And then sore throat or congestion or runny nose might be seen as well. So what determines whether or not you'll be asymptomatic or have a severe pneumonia? Well, there are a number of factors, and probably the most important being age, but also certain medical conditions, things like diabetes, chronic kidney disease, lung disease, heart disease, or immunocompromising conditions, obesity, among a number of others. And this graph just shows the impact of age. So in blue, you'll see the percentage of cases in each age demographic. And then in orange, you'll see the percentage of deaths in each age demographic. And what you'll note is that while the distribution of cases across ages is in somewhat of a bell-shaped curve, with the average age being around 40, 45, deaths are very highly concentrated in the older age group. So about over 30% of deaths occurring in the demographic above the age of 85, and over 25% in those 75 to 84 years old. So age is certainly an important factor in determining risk. And I'd be remiss if I didn't mention the tremendous impact this virus has had on nursing homes in the US. So 41% of US COVID-19 deaths are in nursing homes, even though nursing homes only account for less than 1% of the US population. This virus really does spread like wildfire once it gets into one of these facilities. And what you'll see on this map is the percentage of total cases or total deaths in each state that were due to, that occurred in nursing homes. You'll see in Pennsylvania, about 67% of deaths in Pennsylvania occurred in nursing homes. And actually, we have a 10th member, Dr. Joshua Wee, who's really done some incredible work trying to mitigate the effects of the virus in nursing homes. He continues to work with the state to do that. So hopefully you all can hear from him at some point. All right, so knowing all of that, what should we do now to prevent further infections? And in order to figure that out, I think it's important to know how the virus spreads. So the primary way that the virus moves from person to person is through exhaled droplets. So droplets are these little balls of fluid that have virus in it, and they're in they're in the air when you breathe out, or when you breathe, or when you cough, or when you talk, or when you sneeze, or when you sing. These droplets are coming out. And to a lesser extent, you could potentially pick up the virus through contact, and that means by touching surfaces that are contaminated with the virus. But I'd say that really the primary way the virus is spread is from person to person through droplets. And the way I like to think about how viruses spread is by considering 4 factors with this sort of mnemonic: time, space, people, place. So what that means is that the higher risk situations are, for example, closed spaces where you have poor ventilation, or crowded places where you have many people nearby, or close contact between people, such as close range conversations. And it's not just being in those situations, it's also the amount of time you spend in those situations. So people don't get infected with the virus just by being exposed to one particle of the virus. There's actually a dose of the virus that you have to inhale in order to develop disease. And so the longer you're in one of these situations, the more likely you are to be exposed to a truly infectious dose that's going to lead to disease. And this is a good case study of how the virus spread. So this is a picture of a restaurant in Guangzhou, China. And this was a situation that occurred back in January 24th. So really the very beginning of the pandemic, before anyone was masked or socially distant. And so this is a restaurant, and the family at table A had just traveled from Wuhan, China, which was the the epicenter of the outbreak. They had just traveled from there about a day before. The individual sitting at position A1 was infected, but completely asymptomatic. That person would go on to develop symptoms after they left the restaurant. The restaurant had no windows. It had poor ventilation, and there was an air conditioner on the right-hand side that you can see that was directing air from the right side to the left side of the screen here. And so over the course of an hour, while they were eating dinner, 9 people in that restaurant became infected. So 4 other people at table A, 3 people at table B, which is downstream from table A, and 2 people upstream at table C. So this is sort of a prime high-risk situation where you have poor ventilation, people in close contact, it's crowded, and there's a sufficient duration of time that people can be exposed to an infectious dose of the virus. So there's been a lot of questions about who can spread the virus. And unfortunately, it really is the case. There's a lot of good data that shows that both people who are completely asymptomatic or people who are pre-symptomatic can spread the virus. And in fact, people who develop symptoms from COVID-19 are probably most infectious right around the time that they develop symptoms, or maybe even right before that time. For those who are symptomatic, they are contagious about 2 days before they develop symptoms, until about 7 to 10 days afterwards. And I know with schools opening up, there's been a lot of questions about whether children can spread the virus, and I think there's a lot of information still coming out about that. I think what we know is that it appears children are both less likely to be infected and tend to have milder symptoms and milder disease compared to adults. Younger children in particular, those less than 10 years old, seem to be less contagious than older children and adults. But again, I think this is not entirely clear yet, and hopefully we'll be learning more about this in the weeks and months to come. So knowing what we know about how the virus spreads, the single best effective measure that we have to prevent spread of the virus is masking. And the reason this is effective is because it provides what we call source control. And that means that it blocks infected droplets from the person wearing the mask. So the primary reason that masking is recommended in public situations is because it is preventing the person who is wearing the mask from spreading the virus to others. So that means when I wear the mask, I wear it to protect those around me. To a lesser degree, it also offers protection to the person who's wearing the mask from inhaling infected droplets from other people. So this picture that you see on the right-hand side, the highest risk situation here would be if the infected person is not wearing a mask and the exposed person is not wearing a mask. That's what you see up top with the exposed person on the right. The second highest risk would be if the infected person is not wearing a mask and the exposed person is wearing a mask. Third highest risk would be if the infected person is wearing a mask and the exposed person is not wearing a mask. And the lowest risk situation, obviously, is if both people are wearing a mask. And it's for this reason that many states, including Pennsylvania and New Jersey, have a masking requirement in all indoor public places, as well as outdoors when not socially distant. And not all face coverings are made equal. So this is a sign that we just put up in Penn Medicine facilities about face coverings for patients and visitors, specifically recommending cloth masks, surgical masks, different types of N95 masks, but recommending against use of gaiters. So I didn't know what a gaiter was before the pandemic, but I know now because of this. Gaiters are those, the coverings over the neck people wear to keep warm, and sometimes you pull them up over your face. And there's been some small level of data that suggests that they're actually not effective in preventing transmission of the virus. So there may be gaiters out there that are more effective, but in a high-risk situation like the hospital, we recommend against wearing that. Similar situation with bandanas and scarves, or really any masks with exhalation valves. So these are the masks where you see the little circle either in the center or off towards the side, which is allowing the wearer to breathe out droplets through those exhalation valves. So this really defeats the purpose or the goal of source control. So those are really not recommended. And N95 masks, while they offer some more protection in a healthcare setting, they're really not necessary outside of a healthcare setting. All right, and then of course there's hand hygiene and surface cleaning. I mentioned contact transmission. That's how it's when you pick up the virus by touching a surface that's contaminated. That appears to be less significant than droplets, but I think it still warrants consideration. I recommend using alcohol-based hand sanitizers that have at least 60% ethanol or 70% isopropanol. Soap and water for at least 20 seconds in specific situations, specifically when your hands are visibly soiled. That's when you see dirt in your hands, or before eating or after using the restroom. And then, routine surface disinfectants that we use at home are really highly effective against coronaviruses in general, but also against specifically against the SARS-CoV-2 virus, which causes COVID-19. All right, and then finally, I just want to say a word about what we can expect moving forward over the weeks and months to come. So this is a picture of the pandemic in the US since the beginning in mid-March. You'll remember that we had our peak in mid-April, back when New York was sort of the epicenter, and then that sort of died down. And then in July, we saw really a surge in cases across southern and western US, and that subsequently has declined. But since the middle of September, unfortunately, we've started to see a rise in cases across the US again. This is probably due to a number of factors, but there are a number of concerns with the fall and winter coming, including schools and colleges reopening. I'm sure everyone's seen on the news the large number of outbreaks that have occurred on college campuses across the US, which is accounting for a significant proportion of the cases we're seeing there. And actually, if you look at the people who are being affected currently, they're about a decade younger than those who were being infected back in April and May. So the demographic of those who are being infected is certainly younger now. With the fall and winter, activities are also moving indoors, which is a higher risk situation than outdoors. It's also colder. There's less humidity, which is a more favorable situation for the virus to exist. We also have flu season coming, and there's been a lot of concerns about a twindemic, that is the flu and the coronavirus circulating at the same time, and I'll say more about that. And then, of course, I think for all of us, for everyone, for healthcare workers, for everyone who's experienced social isolation and who's been dealing with the effects of the pandemic, there's weariness, not just from the pandemic, but also from social unrest and a lot of other things happening in the world. And so all of that raises concerns about our ability to control the virus moving into the months to come. So what about flu and COVID-19? Well, I think the positive note that we can bring here is that the measures that we use against COVID-19 also work against the flu. So masking, social distancing, hand hygiene also work against the flu. And I think we've seen that if you look at what's happened in the Southern Hemisphere this year. So the Southern Hemisphere actually has their flu season opposite to ours. It typically happens in the spring. And in the spring this year, they've seen virtually no cases of the flu. They've seen some, but very, very little cases. And the thought is that is due to the fact that people are masked and socially distant, which has prevented flu from spreading. And hopefully we see a similar situation in the Northern Hemisphere as well. On the flip side, there is some concern about patients deferring medical care during a pandemic, which has certainly occurred. Certainly when we were in our peak, there were very few non-urgent medical visits occurring, and this could potentially lead to less people being immunized against the flu. And the concern here really is that if there are significant numbers of both flu and COVID-19, that could pose a substantial burden on the healthcare system. But are hopeful that we can avoid that. And so if I leave you with one sort of PSA for this talk, it is that the flu vaccine is more important this year than ever. It's recommended that everyone age 6 months or older should get vaccinated, ideally by the end of October. And on the right there, you see the burden of flu in 2019 to 2020. That's last year's flu season, which is actually cut short because of the pandemic and the masking and social distancing that occurred that prevented further flu transmission. And you can see on the bottom there the benefits of flu vaccination last year, including preventing 105,000 hospitalizations and 6,300 deaths. All right, and then finally, where is this all going? What is sort of the COVID-19 end game? Well, I think returning to sort of what we call normal depends on getting to a number of new daily cases that's at very low levels, much lower levels than what we're seeing currently in the US. And this would likely require widespread immunity to the virus. We call that herd immunity, where there's a sufficient number of people in the population who are immune to the virus that the virus really has nowhere else to go and nowhere else to spread. Until we reach that level of immunity, either through a vaccine or through people getting infected from the virus, I think masking and social distancing are going to be continue to remain important. There are lots of vaccines in the works right now, 40 some currently in trials, 11 in phase 3 trials, and we're expecting results from those trials by the end of 2020. Despite what you might hear otherwise, the vaccine is going to be rolled out in a phased approach, prioritizing those who are higher risk and frontline workers, and there are likely to be broad availability, hopefully in mid 2021. That's the hope, at least. All right, and I just wanted to leave you with one quote and one piece of scripture here. So the quote is from R.C. Sproul, who said, "If there is one single molecule in this universe running around loose, totally free of God's sovereignty, then we have no guarantee that a single promise of God will ever be fulfilled." And I like this quote because I think I can replace molecule with coronavirus, and I think it's very applicable in recognizing the fact that God is aware of all of this, and there's not a single coronavirus in the universe that's running around without his knowledge. And then the piece of scripture is Romans 8:28. And we know that for those who love God, all things work together for good, for those who are called according to his purpose. So, God is aware of all of this. He's in control. He knows what he's doing, and he takes care of us. So I take comfort in that, and I hope all of you do too as well. So I will stop there. Thank you all for listening. This is a picture from Dalton Farms, where my family and I went, visited last week, and I would encourage anyone who hasn't been there to check it out before the cold weather comes. Thank you.
Thank you, Jerry. I really appreciated that. And that taught me some good information too. All right. So we are going to move on to the next half of our program, which is basically talking about the SMI program and what happened. And to me, this is a celebration because I didn't even know that this program would happen. There, like most missions, Christian trips, etc., that were happening this summer, internships that students had, many things were canceled. And here at Medical Campus Outreach, we really wondered if we would be able to run the program. So if you're not familiar with SMI, or if you are, you know, the basics of the program are that we go door to door with Christian healthcare students, providing blood pressure and blood sugar screens in people's homes. And you can just imagine the likelihood of having a group of students knocking with scrubs on and medical backpacks, knocking on doors and saying, can we come into your home and take a finger stick during the pandemic? It really wouldn't happen. So we were wondering what we would do. And without going into great detail, it took a lot of research, prayer. Jacob gave us some input about the feasibility of running any kind of program and how we could do it safely. We had to look for alternatives. We had to talk to a lot of people, and we found that there was work that could be done by the students at Esperanza Health Center. And we were looking to have one of the biggest programs that we had run in a while. In early March, we already had 18 students applying and accepted. We had to rethink that, whittle it down. We usually host the students together, living together in North Philadelphia, so they can actually live in the environment of the city where they will be working in the dense urban neighborhoods of Kensington, and working in the underserved community there. But we could not house the group together, so we made a decision once we found some tasks at Esperanza Health Center that we might be able to have local students commute in and out by themselves every day. And this came with a lot of guidelines and strictures, such as we couldn't have people taking public transportation and risk getting sick on the way to the program. They had to drive themselves in cars. And would the students ultimately be willing to come to a program that was so radically changed from what they had originally signed up for? So I want to first give some credit to the group, because I was one of the people who had the task of calling them one by one and saying, this is what we might do. We have tasks at Esperanza. However, they're not going to be hands-on patient care. They will be phone calling, supporting Esperanza during the pandemic, getting people signed up to the patient portal so they don't have to come in for in-person visits, updating patient records, gathering data on social determinants of health, which are issues like food insecurity, unemployment, etc., that can determine risk factors or barriers to patient health care, and maybe doing some patient survey information, gathering patient data on surveys and evaluations of their visits. And so this is very different. Would the students want to do something like this even? And I have to say, this really blew me away. Phone call by phone call, hands down, every student was willing to come. They wanted to know more details. They were intrigued. And needless to say, we were able to whittle down the group to 15. And most of those were local students. Amazingly, most had cars, which doesn't happen. If you know anything about college or grad students, most students don't have cars. Many in this group did, which was a real blessing for us. And we had a few students come from out of town, and that was quite a bit of work trying to arrange who could host them safely, how early they could come. They had to come early enough so that they could quarantine some before they arrived in Philadelphia and were hosted by one student, and that one student would be their sole ride in and out. They were not allowed to drive with anyone else. That was another guideline that we had. Anyway, without going into a lot more detail, needless to say, it was a lot of work to figure out the logistics. And then even for them to do the work at Esperanza took a lot of back and forth with the staff. Esperanza is used to hosting interns and volunteers, however, not 15 at once, usually. So that was a challenge. Technology-wise, getting them access to the patient records and data so that they could update information. Esperanza, if you are familiar with working in a small federally qualified health center, doesn't have an abundance of extra laptops to hand out to anyone who happens to do volunteer work. They may have a few, but at this point in time, this was in May and June, most of their staff were working remotely or doing shifts, and they had taken all the laptops. So the students could use theirs, but we had to sync them. The technology hurdles were significant. Having the students come in early and test what their computers could do and try to get synced into the system. There were a lot of challenges, and needless to say, we kept plugging forward. We felt that the help that they could do would be significant, and that even if it wasn't glamorous, it would give them a real appreciation for the patient population in North Philadelphia and Kensington, Hunting Park, give them appreciation for kind of the behind the scenes of what it takes to actually run a healthcare center and the support staff that are needed. And a big part of SMI, in fact, one of the most significant parts, is the discipleship of the students and having them mentored and addressed and engaged in topics that are going to be meaningful for them at this point in their lives and their future career. Fortunately, that was one of the easier parts in theory to plan, because we could do remote presentations like this one, but it took more technology than MCO is used to handling on a normal basis. We usually have a speaker come in and address the students at the location that we're living at or at Esperanza. Instead, we had to make sure that everyone could connect in from their remote locations, that we could record these, that the speaker had good connection, dealing with little glitches and things like that we weren't used to dealing with. But a lot of time and effort was put in by Laura. I'd like to thank her, by the MCO board. A lot of them are here, who put in a lot of time with the decisions that had to be made and praying about it and weighing and examining every issue with scrutiny. And Karen Fritz, who always helps a lot with SMI. She's an MCO board chair, and she also addresses students as a speaker a couple times. And the staff at Esperanza, they were really wonderful. Just the tech staff, the different departments that we worked with, they did an amazing job working with the students, being patient with our glitches, helping teach us the ropes as we went through. And the students were actually taught how to share their faith over the phone with patients. Esperanza is a Christian health center, if you didn't know, and they have the freedom to pray with staff. And so we had a great evangelism speaker during our orientation. We usually have about a 3-day orientation at Esperanza, on 3.5 day. We had to whittle it down. Everything had to be compacted because we decided to make it a 2-week program rather than a 3-week program. And everything had to be condensed really tightly. But J.C. Jones of Epiphany Fellowship came and spoke to the students. He spoke to them about contextual evangelism in the community. He spoke to them about sharing their faith, but with people of color, and how to do that cross-culturally. And it was really wonderful to have him give the students sort of a foundation for why we share our faith and how God works within us when we do this, and how to speak out of humility and love for Christ. So the students basically had their schedule. Every morning they would step up and start doing some prayer and some sort of spiritual part of the program, which would be their small groups. We studied the book of Jonah during SMI, which we chose last fall, which I thought was really ironic, but maybe it's telling of God that he knew. I felt like Jonah at times, because I thought, can we really pull this off, Lord? Can we do this? And the Lord was faithful in helping us work through this step by step, day by day. I really think it was a slow process of seeing it in full, like a flower, petal by petal, day by day. But I'm going to share with you a few photos of the program so you can kind of imagine, like you can give a little sense of what this is like. And Okay, can you see that? Not yet. Let's try it again. Okay, sorry, we've practiced this. There we go. Here it comes. There we go. Can you see this now? Okay, good. All right. All right, here is the whole team. You're going to see them with their masks off right now, which is not how we saw them mostly during the time. We had everybody take this picture really quickly, but this is what they were like most of the time. And then here we had some teaching at Esperanza that happened inside. Most of it was remote, but we had a few speakers come, but you can see that we had to space everyone out. Everybody had masks. And it was not the kind of contact that we're used to during SMI, but we made it work. Meals were very different. We had to eat outside in the parking lot, and we didn't have group meals together usually. We ate lunch, and the students were separated in groups at Esperanza and small clusters where they were working in their teams. But we did, I think, 3 meals together, and we had to go in the parking lot, and we were mostly masked except when we were eating, and then we had to space out and take our masks off. So you can see how we looked here. Here's the guys for a quick minute, taking their masks off as they're finishing their meal. And here we have the students working at their computers. These are action shots. Normally we have very, vibrant pictures of people with children and families in the community taking blood pressures, blood sugars, fire hydrants busting loose with water in the streets. And instead, we have an action shot. Well, this is what they were doing a lot of times, is making phone calls, filling out forms, and entering data, etc. But I loved it because they had such a great attitude. They were really humble and really just went to town with their work and accomplished quite a lot. Here's this is one of the rooms that we worked in. And you can see the students spaced out, each doing their work. They had earbuds, and they're doing their phone calls and praying with people and entering the data and collecting information for Esperanza. Here, some of our students did have patient contact, very limited, but they would collect patient surveys in the waiting room, spaced apart from the patients. And I should add that they were not anywhere near the COVID patients. They were sent to another part of Esperanza. So these were healthy patients coming in for routine visits, etc. And some of these, this was Carrie and this was Amy, and they were collecting patient satisfaction surveys. And here we have their joyfulness. We took some photos at the end of the program, but they were a great team. This is one of the few pictures, actually, a few times that they were together as a whole group. So it was hard for them to actually be together and spend time as a whole group together. And they really treasured the time that they had, because normally SMI is all about being together. So you can see how different this program was. And it was not typical of our typical program, and we really had to adapt it, and the students were really great in going with the flow and learning how to follow our guidelines respectfully and carefully and keep everybody safe and healthy. And I'd really like you to hear from them. I have 3 of the students here to share with you tonight. And I'm going to ask them a few questions and let them share about their own perspective on the program. So let me start with the first question that I have given them these questions already. I have a few that I think would like to answer each one. So first question is, what made you decide to come even after this program was adapted? I think that's a great question because this was not the program they signed up for. So Alexandra, would you mind sharing?
Yeah, hi, I'm Alexandra. I'm a second-year medical student at Drexel now. And I guess when I first heard about MCO and even just the amazing fellowship that we have in like the medical community here in Philly. It was like me hearing God tell me like why Drexel and why Philly. And the whole year I was looking forward to doing SMI. And then when Holly called me and said that, you know, we're thinking of not having SMI because you're not going to get like the same experience. And then I told her, I was like, you know, none of us who do SMI are like doing it for like the medical experience. We're doing it for the like spiritual mentoring and being surrounded by medical professionals who are also Christians, and like finding people that are just like us. Because I feel like everywhere I've gone, I've never really felt like I belong. And when I stepped into Esperanza and I just looked around to the people's eyes, and you see like Christ's love in their eyes, and the fact that they were dedicating their life to helping people, like helping the needy and the poor, just like Jesus did. I was like, wow, I feel like I really belong in Esperanza. And I told her, like, you cannot cancel this program because like, this is how like God works. Like, just let it happen and see how God will like use it to bless us and bless everyone around us. And yeah, I was just like blown away. I met so many amazing people, and we really felt like God working throughout the whole time, and being able to be mentored by like Holly and Laura and Karen. It's just something that I never thought was even possible when I thought about going to medical school. So all of the things that your church does and that you guys do, and the fact that you like even let SMI continue, has like touched me deeply, and I'm sure everyone else in the SMI program. So thank you guys for letting this happen.
Hey, Mezik, did you want to add anything?
My parents, my dad did SMI for a little bit when he was in dental school, and he didn't do the whole program, but for like the few days that he was there, like that made such an impact in his life that up to the time when I told him that I wanted to do nursing school and be a nurse, he was like, you need to do SMI. You need to spend the summer and just do that program, because like Alexandra said, the spiritual mentoring that happens is so impactful that even for the couple days that he went, like it made such an impact in his life up to now. And we had so many great friends that went through that program too. And just the different doors. I'm not going to go into it, but God opened so many doors for me to be able to go into this program that I was like, there's no way I can back out of this. Like the Lord's like made such a way for me to go into this. And yeah, it was, and the program did not fail any expectations. It was amazing. Yeah.
I should add that Mezik came from Florida, and right when she came, it was when Florida started to have its huge spike in cases, and they were almost limiting people from coming from Florida, or were kind of quarantine. And you know, we thought, oh my goodness, we asked this girl to come, and we're asking her to we had to house her. We actually housed her with Alexandra, who had an open space available in her apartment or in her home. And we asked Mezik, can you come early? You'd have to come over a week early so that we can make sure that you are less contagious if you were carrying anything, and you have to be very careful even before you travel over here. There were so many restrictions that we put upon these students, and they all agreed to it, which was wonderful.
It was amazing, yeah.
Okay, what were some of the challenges? I like to hear. This was not an easy thing to do. What were some of the challenges of the program as you were working, or some in the restrictions you faced? You want to go ahead, Channing?
Yeah, I'll take this on. Hi, I'm Channing. I'm a first-year medical student at Temple. When we showed up, like Holly's touched on this a little bit, that it was very technology based, and like just from the start we had a lot of IT problems, and I remember just being so blown away by the Esperanza staff. Like they're in the midst of a pandemic and their workload was so heavy, and they took the time to come and help us like time and time again just to get us going and running. And that was incredible. And once we started going, I think the biggest thing that struck me of like, wow, I really have to overcome this, was the fact that I'm not a Spanish speaker. And the patient list that we were calling were at least 70% Spanish speaking. And just realizing that like I had very little skill set in even doing this like telephone work, right? And I think I can speak for some of the Spanish speakers that I was working with. They weren't super confident in their Spanish, like from the get-go. Like they were like really nervous on the first calls. And it was just incredible to see how God was working through them and building up their confidence, where to the point on the second day, like people were praying over the phones in Spanish for these patients. It was just amazing to see. Yeah.
So I should add that Channing, by the way, is a first-year medical student at Temple Medicine, and his sister handed it to him. And he's referring to the Spanish speakers that we were working with. Those were other students. We had several students who did speak Spanish, which was also a blessing. We usually have 1 or 2 every year. We had quite a few this year, which was really helpful at Esperanza. And they were nervous. Some of them, their Spanish was a little rusty or not strong, but they really dove into it and started to gain confidence as they worked. Okay, next question. I'd like them all to answer. What was a relevant or meaningful lesson you learned, or what did God teach you during SMI? Each one of you can go ahead. Why don't we start with Alexandra?
All right. I learned so much from SMI, but I think that the most important thing I learned was to actually pray with people. And I was one of the lucky people that got to have like patient interaction, and I got to like talk to so many patients, and you hear about like all these people like hurting and suffering, and you feel like so powerless, but our prayers are really powerful. And it's one thing to say like, oh, I'll pray for you, but it's another thing to like actually be like, do you mind if I pray for you now? And so SMI gave me like the confidence and courage to just pray with everyone, because I prayed with so many people like all day. It was just like, can I pray for you? It became like second nature. And it was even in Spanish too, and praying in Spanish is really hard with all the verb tenses, like, oh, Lord bless them, like that's so much harder to say in Spanish. So anyways, I like got over all of those fears of praying for people and feeling awkward or nervous. And I've seen like now I'm so different in school, and even like I've had like FaceTime reunions with friends from college that I haven't seen in a long time. And I just have like this courage now to pray for my friends. And I've prayed for like 3 or 4 people like right at the end of like our hanging out session or our phone call session. And it's been like insanely powerful. Like we both end up in tears, and they tell me like, I really needed that. Like no one's prayed for me like this before. Like, is this what you pray like when you're at your Drexel Christian Fellowship? So just having like the courage to pray for someone, even if they don't believe or they think it's weird, like God still works. So I learned to have that courage and to let God have the ability to move and work in my life and my community, and to really use me. And it's like nothing that I've done or that I can do. It's just like giving people that hope in God, because there's so many like hopeless, hurting people, and all we can give them is God.
Nezek, how about you?
I think for me, I mean, I'm still taking it all in. Like the cool thing about SMI is I'm still like dwelling on everything that the Lord showed me and taught me, and it's an ongoing process. But one thing that really stood out to me is just how going into SMI, I expected God to do a certain work and to work a certain way. Like, he opened so many doors for me to get into the program, and I thought, okay, he's going to use me in this great way. I'm going to make a huge impact. These phone calls are going to be incredible. Or like, just, I had these expectations that this big work was going to happen and that I was going to use my works to glorify God. And when I got there, it was kind of like the Lord sat me down and was like, hold on, I brought you here and I'm going to fill you with mentorship and with discipleship and with like-minded believers who are in the same profession, going into the same profession as you. And it was so like shocking for me, but also so refreshing too, because I think this year's been crazy for everyone. And I felt going into SMI, I felt kind of the burden of, I'm doing so much at home, like I'm running on empty, but I'm excited to be used by God. But God knew what I needed, and I needed in that moment to just be filled by him. And my biggest takeaway from SMI was just being so overwhelmed with the presence and the peace of God, and just the spiritual mentorship was just so incredible. I mean, that was amazing. And my talks with Alexandra, we were in the same Bible study group, and I stayed with her through the program. And that was just such a blessing by God to like put me with her. It was just perfect. So yeah, it was amazing.
Thank you. All right, Channing, do you have anything to share?
Yeah, I was thinking about the opportunity that we got to shadow the chaplain at Esperanza. And I think one of my biggest takeaways, or when I entered this program, I was thinking a lot about like going forward in the future as a healthcare worker, what does it look like to be a Christian and like to pursue a ministry or your faith in this career. And it was really incredible to see a setting like Esperanza, a Christian health clinic, where like we are taking time away, like while shadowing this chaplain, taking time away from the actual healthcare practice, and to go in and have a chat with the patient about their faith, and to come out, and the physicians and the nurses who were working, and they're super busy, they would stop what they're doing and ask. They'd be like, so what was this patient's faith like, and what are they going through? And they really were so involved with this whole process and this one-minded mission of, you know, really caring for a person, which is sharing God and sharing what we do. And I just found that so amazing to even see that as a possibility going forward in a career in medicine. And it was just really encouraging.
Thank you. All right. Why would you recommend SMI? Do any of you have one last final thing to say for anyone? I mean, I think a lot of what you've been saying recommends SMI for anyone who's interested, but would any of you have something to say specifically to someone who's thinking about doing SMI?
Yeah, I have something to say. When I originally wanted to do SMI, I was kind of torn between like two programs, like over the summer, like a prestigious like summer research at some like amazing university, whatever, or like SMI. And the like prestigious one was paid, and then there was like SMI, which is only 3 weeks and like a very inconvenient time of the summer, because it's hard to like do something before or do something after, because it's just like smack in the middle. And I was like really praying about it, and I was like, okay, I can have this amazing opportunity at any, like with this research at any time in my career, but like this SMI thing is like once in a lifetime. And I was like, Lord, I'm not, like, I won't do the other one. Like, I'm going to do SMI because I want you, and like, you're going to further my career so much more than anything I put on my resume, because you've always been the one opening the doors. And I just want to say, because this touched me last year when like a previous SMI person talked about her experience, Tiffany, she was like, yeah, somehow God made it work that I got funded research and did SMI. And I was like, with COVID and everything going on, I was like, that's literally impossible. And then somehow, obviously we know how, like God just opened the doors for me to have like funded research that let me have the time to be able to do SMI. So it's like, if you're worried about your like career or like what everyone else is doing, like God just always finds a way about things that we're worried about. So I just want to encourage like anyone who's like thinking about it, like God doesn't make us sacrifice things. Like he blesses us abundantly more than we could ever imagine. So it's this like SMI experience is something you will never be able to like do in the future. And it was just like, don't give it up for anything. Like this is like a priceless opportunity.
Mhm. So thank you, Alexandra. I'm going to wrap it up, but I just have a few things to say. That's a good note to close on because we actually have the dates for next summer, and we're hoping that it will be closer to our typical program. We may have to make some adjustments and changes, but if we can run it in the height of the first blush of the pandemic, we think we can run it next summer for 3 weeks. And so the dates will be June 26th to July 17th. And please feel free to share with any young student who's in healthcare that you know who might be interested, because we'll definitely be promoting it a lot more over the winter with a lot more information. But I want to close on this note because I was just so overwhelmed myself this whole summer with the students. And just to give you some idea of some of their statistics, the portal and misregistration teams made a total of 716 calls, successfully reaching 275 people, signing up 67 patients in Esperanza's patient portal. All the students and then these two teams updated patient records. For example, Mezic found that she updated 160 patient records during SMI. The social determinants of health team that Alexandra was on attempted a total of 231 surveys and completed 194. And overall, the students prayed with 108 Christ. So I just want to thank the students for all their work and thank God most of all, because he humbled us all so much. I think for myself, who had doubts initially whether we could run an SMI or whether it would be a good SMI that would be worthwhile for the students, I think the lesson that I drew from this is that I think a couple things about this summer is that God reminded me of the faith of a mustard seed and how we don't need to have a grand vision or have supernatural powers because he has supernatural powers. And I also think of that verse, Jeremiah 33:3. It says, "Call to me and I will answer you and will tell you great and hidden things that you have not known." And I think of that verse a lot because I think when we give God a little bit of faith, he shows us how much more he can do. And SMI was really experienced about that this summer. And I want to encourage, I want this to be encouragement for everyone. I think this is good news in the midst of the pandemic of who the Lord is and how faithful he is to us in ways that we could never imagine or think. And I'm just grateful to MCO and all the people who helped us, and Jerry and the faculty and the staff who made this program possible, and to see them being the hands and feet of Jesus to the students, to the community at Esperanza, to the patients. So just thank you. All right, let me close in prayer and we can all go. Dear Heavenly Father, thank you so much for showing us who you are, for encouraging these students and equipping them for their future careers. Lord, bless them, put your hand upon them, and continue to work in their lives and show them who you are. Thank you for all the supporters and the people who are praying for us, Lord. We know that you are advancing your kingdom step by step, even in the midst of the pandemic. We praise your holy name. Amen. Thank you for coming tonight, everyone. We really appreciate it.